All right, should you as a diabetic be gorging on donuts and sugar and cookies and cake? Well, a recent video on social media circulating shows a diabetic woman having a phone call with a friend, and it's a video call and she's munching a donut. And her friend goes, "Hey, are you supposed to be eating donuts as a diabetic?" And of course, the diabetic woman reassures her that yes, indeed, diabetics should definitely be eating things like donuts.
Hello?
Hello. Wait, is that a donut?
What, this?
Liz, should you even be eating stuff like that?
That's a total myth.
Well, it's because you have type 2 diabetes, so I didn't even think that you could have stuff like that.
Sugar doesn't cause diabetes, and people with diabetes can still eat sugar. Just like everyone else, we just have to eat it in moderation. So unless they put poison in this, I'm still eating it.
So is this a good strategy? Is it within the guidelines for diabetes cares? Hi guys, I'm Dr. Shawn Baker. It's hard to tell if this is parody, if this is an advertisement, if this showcase a real issue here. Well, let's take a look at the diabetes situation. In the United States now, currently half of the population, yes, you heard that right, half of the population is either diabetic or pre-diabetic. Does controlling blood glucose with medications, as this sort of video suggests, and not limiting the carbohydrates you consume actually work? Well, according to the Accord trial, which is published in the New England Journal of Medicine, they looked exactly at this situation. They looked at over 10,000 patients with diabetes. Medication was used very aggressively to get their hemoglobin A1C to a very respectable sub 6%, so 5 point something. This was into non-diabetic levels. Now, this was done without changing their diet at all, but just pounding the medications. How did it work out? Well, the trial had to be stopped early because more people in the group that were getting the medications ended up dying. That's right. More people that had good hemoglobin A1Cs with medications ended up dying. The conclusion that they said was the use of intensive therapy to target normal glycated hemoglobin levels for 3.5 years increased, that's right, increased mortality and did not significantly decrease major cardiovascular events. That's because controlling blood sugar with drugs and not lifestyles is not actually treating the disease. That's because controlling blood sugar with drugs and not changing actual diet is not actually treating all the aspects of diabetes. It's just controlling one biomarker. Again, it's a symptom, it's a band-aid on the problem. Patients tend to also experience higher numbers of hypoglycemic episodes, which can potentially be dangerous. And exactly what this donut eating person on Instagram, wherever they were, is demonstrating. So is this consistent with American Diabetes Association guidelines? Well, they say it's okay for diabetics to eat lots of starchy foods like breads and pastas and eat sugary foods in quote unquote moderation. They say that, this is something that we should maybe try to eat less of these sugary foods. But at the ADA website, under myths about diabetes, they say sweets and desserts can be eaten by people with diabetes as part of a healthy meal plan. Now, isn't that an oxymoron? Part of a healthy meal plan? Really, a healthy meal plan should not include a bunch of unhealthy foods, in my view. Now, maybe I'm crazy, perhaps. Why would they say this? That when eating this way as a diabetic will require more medication. And the Accord study has shown what more medication does. It results in more deaths. Now, ClassAction.com has revealed that the American Diabetes Association receives funding from drug companies making these very drugs, such as Eli Lilly, Johnson & Johnson, and Merck. They also take money from Coca-Cola, Cadbury, Schweppes, who makes Dr. Pepper, and so on and so forth. And so, can anybody say conflict of interest? Now, a 2021 4-part news story on Reuters highlighted the diabetes epidemic and the Accord study. The second part talks about the dangers of hypoglycemic reactions caused by unregulated diet and blood sugar medications. The article also highlights the tragic story of a man who lost his life due to hypoglycemic episodes caused by this sort of nonsense. Now, the motives are clear. Drug companies are raking in the profits. They're keeping more people on diabetic meds while using more and more of those medications. The dangers of hypoglycemia become worse as we get older. There are other dangers as well. J&J kept quiet when their diabetes drug Invokana began causing diabetic ketoacidosis, bone fractures, and amputations. In 2017, the FDA added a warning about amputations while being on this drug. Now, that warning was withdrawn back in 2020. Now, it doesn't give me a warm fuzzy feeling about making me want to use this drug, and patients should be concerned about taking those perhaps as well. Meanwhile, research has shown quite remarkably that low-carb diets work extremely well with diabetes. A 2020 meta-analysis of published studies concluded a ketogenic diet is superior to control diets in terms of glycemic control and lipid profile improvement. So we know that cutting carbs helps diabetics, clearly. Maybe it's not good for drug company profits, however. What do you guys think? Do you know any diabetics that eat this way that they're describing, lots of junk food, chasing it with all kinds of medications? Have you met diabetics that experience hypoglycemic episodes frequently? Let me know in the comments if you are a diabetic and if you were able to use a low-carb keto carnivore diet to put your diabetes in remission and get off the drugs. Thank you guys very much for watching, for following, and for sharing this with friends and people that you think will benefit from this. All right, guys, we'll talk to you soon.